Good morning, everyone.
Good morning.
Good morning.
Morning. Feel most welcome to today's session. And we are going to look at module 3. I'm not sure. Is there anyone who was not here yesterday, who has just joined us today? Anyone
Yes,
was
I'm joining for the first time. I'm joining for the first time today.
Okay, Edgar, karibu sana. Yeah. So, Edgar, we have already covered 2 modules. Today is our third module. And then in the afternoon, we'll be having our 4th and last module. But feel most welcome. And to welcome everyone, the ones who were here yesterday. I have an issue with power, but let's see how far we can go. So I'll not use the video for now, but after some time when power comes back, I'll be able to use it. So maybe to start with, we can have a recap of what we did in module 2. Anyone who can remember what we did yesterday, the last module of yesterday, what did we cover? Someone who can recall? We are having a recap. What did you cover? What can you remember? Hello, can you remember? That if Edgar was asked to ask you, mulifanya nini jana? What can you tell him? What is this maybe you can say you did or you covered? Yesterday's recap. Maybe to, yes, Virginia?
The major theories of counseling and psychotherapy. We went over, I think, 4 or 5 of the major theories that are used in counseling.
So which are these, like if, thank you, Virginia, which are these major maybe theories which we looked at least a mention of a few? It's not for Virginia, it's for all of us. Can you remember any of the theories we looked at yesterday?
Yes, there was psychoanalytic dynamic theory. There was behavioral theory. There was also cognitive theory.
Yes.
Humanistic theory.
Good. Thank you. Yes. As we looked at those theories, what else did we look at in those theories? You remember some of the techniques we were looking at? Those are the interventions, which we were looking at. What else? Thank you. What else did we look at? And these theories we were looking at, we'll keep on bouncing back to them because we say that once you have these skills, it becomes so easier for you to deal with any other client or any other issue a person will be presenting to you, because we said you're going to be eclectic, you're going to be holistic, you're going to use to integrate all the theories which you have learned. So what else did we look at? Thank you, Raphael and Virginia. Yes, Karemi. Karimi alikuwa anataka kuongea ama alikuwa anaingia? Okay. Do you remember us talking about some specific maybe clients who might be needing the counseling? Can you remember something like that? Specific clients? Where we say that's how maybe you can counsel like the LGBTQ when they're having issues. Maybe you're dealing with children, where we talked about play and art therapy. Oh, Karemi is saying we looked at the counseling skills. Yeah, which was in the first module. Eh? Thank you. And we also. Yes, Raphael.
The counseling of specific clients, one of them was children and adolescents, and then couples and families. And then we also were looking at multicultural issues when dealing in counseling, in which we dealt with cultural competence, language barriers, cultural sensitivity, discrimination and bias, and then inclusive practices.
Good. Because you don't know the client you're going to deal with, you don't know their culture, you don't know what they do and what maybe they don't do. But we usually say that again, we need to be very sensitive when we are dealing with such like clients. Thank you. And also we looked at the last one, which was talking about ethical and professional issues. What can you remember under ethics and professional issues? What can we remember on ethics and professional issues? You know, in recap too, so that tunajikumbusha, we're just reminding ourselves on what we covered. Yeah, we talked about ethical and professional issues in counseling. What can you recall?
Confidentiality, dual relationship, and boundaries, legal consideration, therapist self-care, ethical decision making.
Yes.
An informed consent.
Yes. And even the issue of confidentiality. Wow, thank you so much. Even we talked about the issue of dual relationship. And remember when we talk about the ethical and professional counseling, we said ethics is what guides you. It's what tells you maybe that what you're doing, is it right, is it wrong? Maybe you get to know your boundaries, what you're supposed to be doing. So that is what we covered yesterday. And thank you so much for that recap. And we usually say that even if you pick one, because I remember one of the expectation of one of the participants, I don't know whether she's here today, is to pick something, one new thing, at least something new. So I hope maybe there's something which you're also getting. Now we are going to look at the counseling on specific clients. Like when we talk about specific clients, this is where we are talking about, and I want to talk about this counseling on specific client issues. In most of our workplaces, I guess we have, some of us, we call them the cross-cutting issues. The cross-cutting issues are those issues which you can find anywhere. It doesn't matter your organization, what you do, as long as you have the human who are existing in that organization, they have these issues, they cut across, they don't have a limit. And each one of us, maybe we have such like issues. And it's good when you get equipped with these skills so that when you get such like employees, you can be able to listen to them, you can be able to assist them. And these are the ones we say that when you're doing mainstreaming, we usually talk about when mostly like the issues I'm seeing here, especially if you're in the docket of the issues of HIV, because under HIV, that is why they have talked about mental health. That is the issue of that depression, the issue of stress, the issue of some of these issues which we're going to look at. And then there's also this issue of substance abuse in our workplaces, which we call alcohol and drug abuse, or whichever substance which is being abused. Then how are we supposed to handle these clients? How are we supposed to assist these clients? And I know each one of us, we might maybe have our own, even the people we work with who are going through this. So some of the issues we're going to look at is stress. We're also going to look at the anxiety, depression, loss and grief, self-esteem issues, addiction issues, relationship issues. And that is why I say that these are some of the issues which cuts across, and whether it is vertically or horizontally, all of us, we go through these issues. Some of us, maybe we have our colleagues who are going through these issues, even our own. So those are the things that we are going to look at. And as I said, the skills which we learned, or whatever we learned in module 1, and whatever we learned in module 2, those are the theories, knowing how ethically we are supposed to do our counseling when we are talking to our colleagues or to our friends, and even the techniques which we have also learned, they are the ones now we are going to use here. It is like it's a repetition of mostly what we did yesterday. We want to lift those theories. We want to lift those skills. We want to lift the counseling process, all the ones which we looked at. Then now we see how do we come in and we help the employees who are going through these issues. So these issues which clients are going through, that is what we'll be looking at. So we'll maybe be able to understand what is stress, and then from there, how do we come in and we intervene using the skills or the knowledge we have attained to help a client who is going through stress. And when we talk about these issues, it's like we also want to understand, how will you know that a person has stress? How will you know that a person is having anxiety, depression, that loss and grief? What are we supposed to do? So that is what we are going to look at. And one of them is that stress. By the way, what is stress? And don't leave me to talk alone. So what is stress? From your own understanding, what is stress? Yes? What is stress?
Maybe I could, this is Edgar Mutai, maybe I could just hop in and say stress is what pushes you outside your comfort limit and pushes the negative aspect of you to come out. Mm-hmm. So that's briefly how I could see it.
Yes. Mm-hmm. Thank you, Edgar. Yes. Stress.
Stress is the difficulty you have in coping with mental or demanding circumstances.
Mm-hmm. At the what? Repeat kidogo, Virginia. Stress is what?
Stress is when you have difficulty coping with the circumstances around you, be they mental or be they physical.
Okay. Mm-hmm. Thank you. Yeah. Stress. Thank you. As we're here, do we have stress? As we are here, the 7 of us, do you have stress?
Not that I can think of. I think I'm okay today.
Uh-huh. Yes. And is the stress good? Is the stress good? Well, stress ni nzuri. I know I'm asking so many questions. Is there anyone again who is stress-free?
Stress is good to the level that it pushes you outside your
Okay. Okay. Thank you so much, Edgar. What I can say, net inaleta shida. Counseling, as we talk, stress is good. Stress is, it makes you to start jogging your mind. Because when we talk about stress, is when the pressure is so much, pressure is the demands which you're talking about, they are so much than the resources you have. So pressure is greater than the resources which we have. So you find that there's a demand which comes and we need to respond to it. And we need to address it. And we need to look at some of these issues. So you find that pressure which we have, those demands which we have, which want us to maybe to do what? To respond to that, they are not enough. And this is now what makes us to start thinking, what am I going to do? I have a child, I need to, maybe 2 children or 3 children to go to school. The finances are not enough. What am I going to do? I'll take maybe some cash here, this school. I asked for permission. I take some, you start now thinking, and then you start planning, how am I going to raise these school fees? So because of that demand, which we are calling that it's a stressor. Because of that stressor, it starts making us to jog our minds. It starts making us to start thinking so that we can be able to get a solution to whatever we are being maybe requested to. And that is why we say that when we are talking about the issue of stress, each one of us, we have it. And we usually say that stress is good. It's if we have those demands which we need to respond to, then we don't. Because most of us, when we have stress, there are some who maybe go to use their substance abuse. Once you take alcohol, you come, you sleep. But once you come back, you sleep. Is it going to sort out your issues? Is it going to help you to find that solution? So you find that when you're doing that, you are just adding more stressors to you. Or you have a demand, then you do what we call procrastinating. You postpone it, that you'll do it next time. As you're postponing to next time, another demand is also coming. But we say that it's good when you have these demands, you plan on how you're going to address this issue. And that is why we are saying in counseling, for stress involves various techniques and approaches which are going to help us to manage or reduce. And by the way, when we have some management of stress, how you can be able to manage your stress. There are those stressors which we have, and we usually say that understand what stress is. Once you have understood what stress is, get to know the causes of stress. You get to know the causes of stress. By the way, what are some of the causes of stress? What causes us stress? What are some of the causes of stress? When you talk, najua kuna net. So what are some of the causes of stress?
Work-related issues, like when your boss keeps insisting that you're not working up to standards required.
Yes. Yes, when you talk about work-related issues, maybe there's that life changes. Maybe there's that issue of divorce, or you're getting married. Can it be a stressor? Healthy issues or concerns. Or maybe when you're talking about the financial issues, when you're talking about the issue of relationship, when you have that pressure for academic, maybe the children are going to school and such like things. Maybe you are also having the daily hassles. Can those be stressors? Yes. And we usually say that even if you don't know even the cause of your stress, then you need to know some of these symptoms. How can you be able to know that one is stressed? So you need to know the symptoms. And under this stress, that is why we say that how can you be able to manage your stress? Before even we look at some of those theories and some of the techniques from that, from those theories, let's just say generally, how can we be able to manage or reduce the stresses which we have? You need to be assertive. And when we talk about assertiveness, it comes from one of the theories which we did yesterday. That is the behavioral theory. It's one of the techniques under behavioral theory that someone needs to be assertive. You know, when you're assertive, is kind of, you can be able to stand on what you're, maybe if you're saying no, you mean a no. Not that you're saying no and you later say yes. So we want someone to be able to say their opinion, their views, and being sensitive without being aggressive. You care about yourself and you're also caring about the others. That is the assertiveness we are talking about. Because if you can be able to talk about what is in your mind or in your thought, then someone, whether it is going to be taken or not, you know, it's going to help you. So that is one of the management of that stress. Or the issue of time management. You plan well, you have 24 hours. And then some people say, me, I don't have enough time. And other people even finish earlier. Yeah, and they ask yourself, is it that they have that 6 hours? All of us, we have the same timing. How can we be able to plan well? So once you plan well and you manage your time well, you'll be able to manage your stress. Then we avoid the issue of procrastinations, postponing issues, that I'll do this, I'll do that. Like now, if I may ask Mutai, when did you learn that there was this presentation? Is it yesterday? Is it today morning? And when did you, let me get it from you. When did you come to learn about it?
Actually, I learned about it on Wednesday. And then because of matters beyond, again, my limited time in my consultancy, I realized this morning I have not paid and I wanted to be in part of this meeting. Then later on, I learned this morning again, there was a session yesterday. So it kind of, I said, I'll take what I have today, but what I want to do is pay close attention to ACHRP emails, so I can be on board sooner than later. And actually, the journey starts today.
Okay.
Thank you.
Yes. Because if you keep on postponing, another issue will come. And that is why now why you decided just to join. And that is why we're saying what you're able to do it now. Instead of you planning that you do it tomorrow, another stressor will come in or another demand will come in. So how are you going to address all those? Because there will be so much. And that is why if you have so many demands and you are not able to respond to them in a right way, this is what makes people to go into depression. So, and it takes someone to have what we call the distress. And once now you have that distress, it will take you to what we call post-traumatic stress disorder, which is already now a mental issue. And that is where we don't want to go. It's good you get to know how to manage this. So, and the people who are perfectionists. The perfectionists, they're the people who don't want to delegate whatever they are doing. Because if they delegate it to Flora, they feel like, Flora cannot do my way. So you want to do everything. You want to be everywhere. You want to, like, whatever maybe someone else could have assisted you, you just want to do everything. By the way, that one will make you to be stressed. That is why you need to work the perfectionists. Perfectionists are those people who want to see the things happening the right way. So you need to work on your perfectionism so that you learn to delegate. Delegate also is another management skill on how you can be able to manage your stress, that you delegate it. And don't delegate what you don't like. So at times, even in our workplaces, people only delegate in food to the one which is not fertile. Please delegate work, even the good ones, the ones someone can also be able to benefit in whichever way. Don't delegate the work which you know that there's nothing you're going to benefit from that. Those are some of the skills you work on your perfectionism, you delegate it, you relax, you take, you do exercises, and you avoid procrastination, you manage your time, among the others. So here we have some of the techniques, like what we learned under the behavioral theory, the one we did yesterday, whereby we are supposed to help clients so that they can be able to identify and change their negative thought patterns. Because mostly what makes us to have even that stress is that attitude which you have towards things. That attitude which you have, even when we are talking about the issue of work-related issues, and I know under work-related issues, people have so many other issues. So how are you looking at it? How are you approaching it? How can you be able, and this is what we say, and this is what is also going to contribute to those issues of stress, because you are given work, or there's that workload which you have, instead of you performing it, you wait, another one comes tomorrow, another one comes. And that is why you say, when you go to someone's office, you find this person has a heap of files, and you go to Virginia's office, the desk is clean. Who has a lot of work among the two? Who has a lot of work among the two? Yes? Who has a lot of work among the two? Is it the one who has a clean desk, or is it the person who has a heap of files? That one, it depends how someone has planned himself. How someone sits down and starts telling himself, I think I need to do 1, 2, 3. And if you are a person with that positive attitude, you put aside your irrational thoughts that even if I finish this work, I'm not going to do it, but you do your work the right way. And that is why we say that you cognitively restructure your thoughts so that they can be able, when we talk about behavioral activation, is like the way you're going to act, the way you're going to handle yourself, you know, it can help you to do the work you're supposed to be doing. So please, let's note that the person who has a heap of files, that is the one who has a lot of work. Maybe that person, he has not planned well. He has that negative attitude. He has those thoughts which are not, he is a person who thinks maybe irrationally and is not planning his work well. So please, let's always try to see how can we change these negative thought patterns, especially of behavior, so that we can be able to be constructive. We start thinking positively, we do our work, and we know that when we went there, there's work which we are supposed to do. Then we also have that mindfulness-based stress. When we talk about this mindful-based stress, it's like you are focused. Yeah, it incorporates those mindfulness practices, like you are there, you are meditating, you are using that yoga, you want to help these clients to become more aware about their thoughts and feelings. What are you telling yourself? As you're having this stress, how are you going to manage this stress? What are you going to do so that you can overcome, or you can manage, or you can reduce these levels of stress? Because as we said, stress is not bad. We have the eustress, which is good, which makes you to start thinking, and we have the distress, which can take you to the post-traumatic stress disorder. But when you become that mindful, you start now focusing on your thoughts, on your feelings, and you're like, you're telling yourself, no, I think I'm not doing well. What else can I be able to do so that I can be able to have good feelings, so that I can be able to have those positive thoughts, the rational thoughts? Then if you start now working on your thoughts, on the way you are looking at things, on the way you are addressing issues, then it's going to help you to reduce your stress. But if you're always looking at it, I know there are those people who are blessed with money financially. Me, I cannot be. Whatever little you have, can you be able to start planning and you think about it and how you're going to spend that money. There's no money which is much or which is less. Whatever less money you have, and again, we usually say that focus on the amount you have. You live according to your limit, by the way, you not be stressed. But if you want to live a Me Too syndrome, this is what is going to make you now to start having these stressful issues. Just live to your limit, then you have those positive thoughts, and it will make you to have those feelings, positive feelings, which are going to help you to reduce or improve your overall well-being. So those are some of the things you also need to be looking at to manage that stress. Just think positively, yeah? Then we also have relaxation technique, which I also mentioned just among the ones you can be able to manage your stress. Relaxation, we get it from the behavioral theory. When you have some behaviors and you want to unlearn those behaviors, the first thing you need to do is to relax. And that is why we say when you have this stress, just relax. Relax, and you take that deep breath. And this is where people are told, breathe in and out. And then they say, those are for primary kids, the PP1, PP2. Nowadays, they're being called like that. But remember, in most of the issues a human being goes through, it gets trapped in the muscles which they have. So first, because remember when we were looking at these theories yesterday, we say that at times, there when you want to talk, like when we are looking at the Gestalt theory, you get what we call the energy blocks, where when you want to talk, unasikia like you've been blocked on the throat. So it's like that, those are the energy blocks. Or instead of you verbalizing, then you're coming up with this fist, like you're banging even the table. Or you find that maybe your muscles, that is where we have, instead of verbalizing, that information goes to those muscles. That is why now, whatever stressors we are going through, the first thing we need to do is just to use that relaxation technique. Can you breathe in? You breathe out. You breathe in, you breathe out. And that is why we say those are the breathing exercises. They are going to help us to relax our muscles, and they're going to guide us to have that imaginary journey, because we say at times we want you to start imagining. You have that imaginary journey, or maybe where you could like to be, or what is going to make you happy. And we usually say that you close your eyes, you just listen to yourself. So these techniques can help clients also relax their bodies and their mind, which can be able to reduce the physical symptoms of stress. And remember, when you have stress, by the way, you are so fatigued. It's like you have carried very heavy things. And now here you're using these relaxation techniques is going to help us to feel like we have offloaded the luggage, which was especially on our shoulders, whereby you walk as if you are so tired and you have not even done anything which is going to make you to be tired. The other way of managing this stress, remember we looked at the solution-focused theory. Remember the solution-focused theory which we were looking at yesterday, whereby we said, I told you this solution-focused theory, it's like, it's mostly used when you are in a crisis, is a brief therapy, and whereby, just a minute, whereby when you are using this, I want to minimize this. Okay. When you're using this solution-focused therapy, this approach, it focuses in finding solutions in the present. Remember, this is now a humanistic theory. And remember, the humanistics, we say that the present functioning of this client is what is very critical. So as we'll be looking to the other issues as we move on, we'll be referring back to these theories all the time. So this approach, it's like I'm supposed to find a solution in the present issues which the client is going through. And these are the ones we say that, like, you want to explore some hopes for the client. What is this client wants to achieve? What is this client maybe is looking ahead and they want to? And remember, the key concept of this theory, the solution focused, it mostly focuses on solutions. And they try, one of the goals under this is to try and identify the solutions which can be found immediately. So here, the client as an expert, remember I told you, when you are a humanistic, the client always is the expert. So if they are experts in their lives, in their own lives, they know these stressors, they know maybe their strengths, they know their weaknesses. So what is this which they are going to do so that they can be able to manage the stresses they are going through? And the solution focus is goal-oriented. I just wanted to give you an overview so that you see how you can be able to bring it in. It's an overview, like it aims mostly to clear or to come up with those achievable goals, the goals which the clients wants to accomplish. The goals, like when you're looking at these stressors, when you're looking at maybe they're having work-related issues, what is this they want to accomplish? They want to have good relationship so that they can be able to work with the other colleagues and they have their income. And this brief therapy, which we call the solution-focused brief therapy, it has time limit. It has limited sessions. And by the way, you can just have one session and you move on. And this is the theory which asks clients many questions. All the time is about the questions. So it's focusing on those quick and effective changes, how they can be able to move on. And that is why we look at the future, it's future focused. What clients can be able to do so that they can be able to achieve that in their future, rather than looking at it as part of it. So what is this maybe you are going to do so that you can be able to manage this stress of maybe someone is getting, has been told that there's that separation, or there's that, because those are things which have happened. How are you going to cope to live without this person? So those are the questions you'll be asking these clients. And one of the techniques, like what is said here, it includes like the miracle questions. And this is a question you can ask a person who is stressed. And when we talk about stress, are those demands which we are asking. So you try to make your client to imagine that about their future problems, to imagine a future where their problem or their problems are solved. You are trying to look at the future when you're looking at solution focused. And this is where you say, you try to help them clarify what exactly is their goal, what a successful outcome looks like for them. Like now, if they have these stressors, maybe either it's financial, or they're having the issue of relationship, or they're having the issue of life challenges, or they're having the issue of health issues, and then you can pose this question to them. If a miracle happened, and your problem was solved overnight, the problem we're talking about overnight are those stressors. What could be different in your life? You know me, I have so many issues. I don't know where to start from. I have this and this and this. So you ask them, just if a miracle happened and your problem was solved overnight, you just go to sleep, when you wake up in the morning, those stressors are no longer there. What could be different in your life? How could you have responded? What could be different in your life if you wake up in the morning on all the stressors you had, they're no longer there? How could you, if I know all of us, we have those stressors. Suppose you go to sleep and overnight, you wake up in the morning and all those stressors are not there. What will be different in your life? Hey, people. At least you talk so that I know the net is there. What will be different?
I think you'll be more motivated to go and do other, you'll be motivated to do more things.
Yes, yes. Because of you wasting your energy, going around, thinking around the solution to all this, you'll be a happiest person. Yani hauna issues zingine, and that is what now we are being told here. If a person has stress, you can still be able to use the solution focused brief therapy to assist this client. Imagine if you wake up in the morning, you go to sleep, and then when you wake up, you find that all the stressors you had, they were no longer there. What could be different in your life? Because we want them to be focused. Okay? Then the other technique, thank you so much, Virginia. The other technique is on scaling question. And this is where we say, as a client comes here with all these issues, you can use the scaling questions. And I told you this theory, it has so many questions, whereby a scale of 1 to 10, let's say 10 is the worst. And you want them, when they come in, they have a lot of stress. And now as you're asking them this miracle question, as you're asking them those exceptional questions, because at times we also have the exception questions, like at times when this problem is not in existence, you ask them when they don't have these stressors. If you were to come up with this scaling, you ask your client to rate their feelings. So they're supposed to rate their feelings, so that they can be able to assess their current situation and track the improvement. Maybe they have tried to use some of those management skills of stress. They have tried maybe to start delegating. They have tried maybe to do the relaxation. They have tried to do those exercises. They have tried maybe to be assertive and such like. So where now you want them to start scaling themselves on, they assess their current situation and they look at that track of improvement, whether there's anything which is progressing. That is how we scale it. And I know this scaling, mostly when our clients come for a session and they're talking about the issues they're going through, which we look at maybe as stressors, as they're going through them, then you ask them after some time, you have talked to them, you have used the active listening, you have used the minimal prompts, you remember the questioning, the communication, you have made this person to feel that warmth, and here he or she is, and is trying now to assess themselves. So when they came in, they were at 10. But now as you have been communicating, you're listening to them, you're making them now to start changing their cognitive way of doing things. They are relaxed. How are they feeling now? So they maybe come to level 8. So that questioning skill is also one of the techniques under the solution-focused brief therapy. There are so many other techniques under this. Like at times we ask, you can think of a time when the problem was less an issue. How were you feeling at that time? So that is when at times we call it the exception, like finding question. You want to look at when that problem was not there, when those stressors were not there. And this one, by the way, it encourages those clients so that they can be able to recall the time when maybe the problem was less severe. So how were they at that time? And you're also trying to help them so that they can be able to identify their strengths and resources they have within them, so that they can be able now to look at it in a lesser way. And what is this you're going to do as this problem is there? And I know it has been there. So what is this? Maybe they look at it as a lesser an issue than the way it was there before. Yeah. So those are some of the things you can be able to use, or this theory, which you can be able to use so that you can be able to help that client who is also having the stressors. The people have issues. And that's why you should say, if you don't have an issue, then that is already another issue. There's also that acceptance and commitment therapy. And remember, if you have stressors, we want to encourage our clients so that they can be able to accept their thoughts and their feelings rather than fight them. And whatever we are going through, instead of us blaming the other people, pointing the other people, can we be able to accept the situation in which we are by being that mindful? And mindful, we say that you are looking into yourself, you are looking around you, you are looking what you can be able to do, and you'll be committed to that. Instead of now, when you're fighting, means you're always complaining, you're always blaming the others. And that is why we say in counseling, most clients who come to a session, they have never owned up that I'm the manufacturer and the producer of the issues I'm going through. They're always talking about how the other people have made them to go through the issues. This theory tells us, can you be able to accept whether it is the others who have made you to go through this? It is okay. The others are not here when you're having those feelings or those thoughts. You are all alone. What is this you need to do? You need to be committed. You need to sort yourself, and you live a happy life. You are not living a life for the other people, but you are living your own life. So these stressors which we have, it is us who can be able to sit down and we look at it. How can I be able to manage this stress? You be your own. You look into yourself. You are the source of everything. As much as those issues are there, you are the one who has that solution to sort out your issues. And that is why we say that when you listen to your inner self and you come up with a decision from the inner self, it works well. But when you're going out there externally to get other people to tell you what you're coming to do, then you're not your real self. And we want you to accept what is happening. You get committed so that you take that action as an individual. You own it up. If you have any question, kindly don't hesitate to ask. Then we have that supportive counseling. And remember, we usually say that counseling has to be supportive. And that is why we say counseling, you can challenge your client, but you need to be very, very supportive. And that is why we say we use the supportive skills. When a person comes that this is the issue they're going through, they don't maybe have school fees, they don't have that food, there's that traffic jam, Gen Zs are there, they cannot be able to carry on their business. You know, those are stressors. Gen Z are stressors. As much as maybe they're doing good job and they have communicated what was supposed to be communicated, already it's a stressor to some people because they cannot be able to meet their ends. And when they come, they are talking about these issues. Please be supportive, providing that safe and supportive environment so that these clients can be able to express their feelings. They can be able to express their concerns. Then they can maybe, if this can be able to effectively reduce the stress the clients are going through. And that is why we say when people come and they're telling you the issues they're going through, remember those are stressors. Those issues, those concerns. Don't just tell them, yeah, I can't assist you, I'm not able to. Just give them that listening ear. Just listen to them. Just be empathetic to them. Accept them with their challenges they are going through, with those stressors they are going through. And that is why we say this approach, it involves active listening, being empathetic, being genuine to your clients, accepting them the way they are. You remember the core conditions we are talking about? Yeah, being observant, you observe their gestures, their nonverbals, so that a person feels that you are there for them. So even if someone has stress, he can be able now to sit down once they are relaxed and they start thinking, once they cognitively restructure their thoughts. So these techniques can be tailored to fit an individual needs, and it can help them to manage the stress which they are going through. Because if you're not relaxed, if cognitively you are psychologically disturbed, then you cannot be able to reason. And we want you to be cognitively, your thoughts, you restructure them so that now you can be able to sit down and reason. Once you reason, then you can be able to start solving your problems, or you can now be able to start making decisions. But if you cannot be able to, then you cannot be able to manage your stress. Any question up to there? Then we have another issue, which is anxiety. By the way, what's anxiety? What is anxiety? You know, we brainstorm first. What is anxiety? What is anxiety?
I don't know to put it this way, that feeling of helplessness, or you feel like you can't quite meet it. That's the way I would put it.
Thank you. Yes? Anxiety. Are you anxious as you're here? Is that what is making you not to respond to my concerns? What is anxiety? Anyone else who wants to attempt?
I want to attempt.
Yes, Raphael?
Feeling uneasy unconsciously.
Yes, yes. And consciously feeling uneasy. Yes. Let me see what someone has. Feeling overwhelmed. Feeling overwhelmed. Okay. And this one, thank you so much. When we talk about anxiety, you remember the theory we looked at, the psychoanalytical, psychodynamic? They also talked about the anxiety. And most people have this anxiety. How can you be able, and this is where we talk about, there are times when we talk about that anxiety, it is, you're just anxious. And when we talk about this anxiety, it is that natural emotional response. It's just natural. Like what you said, it's unconscious, you unconsciously, you are just reacting. You start having maybe those feelings of worry. You start becoming nervous. You start having that fear, maybe because of maybe the upcoming event or the situation. That is when you start now having that anxiety. So it is that natural response or natural reaction. And it can be normal part of life, especially when you are in a very stressful situation. Which you are going maybe to do, or you're going for an interview, or you are going for visiting someone maybe whom you have, I hope net is there. Yes. When you are doing all that, that is what we talk about, the anxiety. And when it becomes excessive, please you let me know if it goes off. Are you there?
Yes, we can hear you.
Yes,
I can see my net blinking, so that I change to the main one. I changed when power went. So please, if it goes off, let me know. So like when you are in that stressful situation, then this is what makes us to have that anxiety. And when it becomes excessive, it can also be able to interfere with our daily activities or our overall well-being. You know, you're just anxious. Na kuna wengine nasema, I just have fear, the fear of no fear. I really don't know what the fear is all about. So you can have that fear, which we are talking about, because of that anxiety. It makes us to be anxious. It makes us to have that phobia. It makes us to have that fear, even the fear of the unknown. You are just worried and you really don't know why you are getting worried. So when you are dealing with these clients, the clients who are having that anxiety, let me just see. Yeah, when you're dealing with the counseling those clients who have maybe are anxious, especially when we talk about the client who have some disorders. Remember, this anxiety can make people to have some of the disorders, like when we are talking about this, the types of anxiety, it can be like generalized anxiety disorder. And when you hear just the word disorder, already it has gone to that mental illness. There's that, like when we talk about generalized anxiety disorder, there is that persistent, or there's that excessive worry about the various aspects of our lives. Like now, we don't know this Gen Z, where they're going to take us. We really don't know the new cabinet which has been set, whether it's going to meet the needs of the Gen Z. I don't know whether it's a concern for you. I don't know maybe whether your job, you're going to sustain it, or you're going to lose it, or you're going for retirement, and what am I going to do after that retirement? And remember, most people, especially the people who are going to retire in organizations, they are always anxious. Because I've seen in even in our own organization, someone has retired and they keep on coming to work, and they need to be removed. They have to be removed by the HRs. So what is this they are fearing? They are anxious. And this is because they are anxious and worried because of this aspect of, how am I going to live without this job? And that is when now you need to come in and you try to help these clients. And when we talk about this anxiety, there's that what we call the social anxiety disorder, whereby we have that intense fear of social situations, being judged by the others. Umefanya kazi all these years. What else have you been able to do? We are waiting for you out here. I hear that is what most people say, yeah? Maybe you never used to say hi to us. And not that you never used to say hi to them. It's because of the leave days. You have few days, you are rushing home, you want to be there a few days, then you come back. But it's like, you never used to say. So those social anxiety disorder which these people have, how can you be able to help them? And remember here, when you're going to help these clients with that anxiety which they are having, you are not dealing with the others who are judging him. It is him to deal with himself. And that is why we usually say in counseling, when clients come, they like talking about the other people. In this session, the other people are not here. I'm sitting with you. So how are you going to sort yourself out and you forget the others? Because if you want to please the other people, it cannot be able to be possible. So what is this you're going to do so that you can be able to please yourself? There are some who will be having that panic disorder. I don't know, you have heard people saying, I'm just having that panic. But now it recurs. Recurring that panic disorder, like panic attacks. And some people fear about their future attacks. And by the way, if you are an HR, this is something you need to be talking to your staff. And there are some people who have specific phobias, that intense fear of specific objects. When we talk about these anxieties, we talked about anxieties, the fear, the phobia. which clients will be going through, whether it is that social anxiety, when you have that specific phobia. How do you come in and you help this client? How do you come in, a person who fears heights, a person who fears spiders, a person who fears women, or they fear men, they cannot go into a group and they talk to men. How can you be able to help these clients to overcome that? And that is why we are saying that when you are dealing with these anxieties, people have them, but they cannot. And just go and try and tell someone, stand in front of people and you talk to them. By the way, I'm one person who never used to stand in people and talk, not even in front of people. Visitors, when they used to come and visit us, mine was just to go, I just shake their hand and I disappear. I used to fear until I was like, aha, you have to just be asking them, how are you, where you have come from, is it raining? You know, you fall short of words. So how do you overcome this fear or this social disorder, this fear which you're having? Some of the signs to know that a person has the anxiety, emotional. We say that there are those emotional where we talk about those feelings. They're feeling so restless. Hapo naanza kuona this person has the fear. Cognitively, they cannot be able to sit down and make decisions. It's like it becomes very difficult for them to concentrate. It also becomes very, like their thoughts, they are racing. Mafikira yao, it's like they are racing. They are overthinking at times. Then there you know this person has an anxiety because they're thinking ahead. What is going to happen? Suppose I do this and I fail. I cannot be. Like there's one organization I was doing therapy for them. And that employee told me, you know me, I have fear. I know how to do my work when he does it remote. But when he's working with other people, now he's being told that you need now to go and talk to them, how that model works. He can't. He said he was very fearful. And I was like, did you try it? I tried and you did it, yes. Then you can do it better. But just people have that fear. And there's some people who have that, some other symptoms for you to know a person has anxiety, then is whereby they have that physical, that increased heart rate beat. The heart is beating. Or there's that sweating. That's why you find some people, they're in front there, they're presenting, they have an handkerchief. No, and then you say it may be hot, but that is anxiety that person is going through. They can also be trembling, they can feel fatigued, they can be having the muscle tensions. So you know this person has that anxiety. And what causes this? What are some of the causes of people to have that anxiety? It can be genetic. Maybe it depends with your family, how you were brought up, the history of the history of that anxiety, which is related to that disorder. Or it can be the environmental. Environmental means if you are in those stressful events which you have gone through, or you have gone through significant changes, by the way, they cause a lot of anxiety. Or maybe there's that biological imbalances in the brain chemistry. It can make someone to have that anxiety. Now, let's look at it. How do we intervene? Like when we talk about intervene, we have those therapeutic approaches, the ones we are looking here again, the one for cognitive. How do we help this client? Because remember, we have said they can have those difficulties in concentrating. They have those thoughts which they are thinking ahead of the others, that overthinking. Then this is where, again, we bring in the CBT. These people, they need first to relax. That relaxation, whereby we need to focus on therapies for this anxiety. We need to focus on identifying and changing their thoughts. The key issue here, especially when they're having the issues, the anxiety related to their cognitive, with their thoughts, is just to sit down and ask themselves, when I'm talking to these people, if maybe it's about the situations, it's like as I'm talking to these people, can I look at it? It's like when I was talking to Virginia. What different is it going to be if I sit and talk to these people? It's like I'm talking to my friends. So they change their thoughts and then they relax, then they can be able to do their presentation. So that cognitive restructuring, this exposure therapy is whereby you gradually, when we talk about the exposure, this is where we say you expose them gradually. And this exposure, it can either be like you do it systematically, or you can flood them so that they can be able to overcome that anxiety which they have, that fear, that phobia. And that is why we say they can start, maybe if it is Virginia who has a fear of males, mupatie Edgar na Raphael. She talks to them. Next time, ongeza some other males. Next time, let her talk to around 20. Next time, let her talk to 50. You are exposing them gradually. And this is going to help them to overcome that anxiety which they have. And this is the one we are also talking about here, exposure therapy. That is a type of cognitive behavioral therapy, exposure, whereby gradually you expose clients to the ideas or objects that trigger the anxiety. And that is why in a controlled environment, like there are some people we talked about, they have anxiety of the heights. What you do, you can expose them gradually, or you can do it, how do I say it? Randomly, you expose them to that fear, which triggers that anxiety. And that is why if they fear the heights, you can just put this client. And remember, when you are using this theory, cognitive, behavioral, these are behaviorists. They like you doing you explain to your client how you're going to use some of these interventions or some of these techniques. If they fear the heights, put them in a lift. If from ground floor to 30th floor, ni express, because you are exposing them. And that is one. But again, we say when you are using that, especially the one for flooding, you have to be very, very careful, because at times it can cause heart attack. So you have to be very careful when you're using the flooding, but you expose them either gradually or you expose them excessively to that fear they have or anxiety. It will be able to help them to reduce that anxiety which they have. Acceptance and commitment. This is whereby we need to encourage our clients that they have that anxiety. You know, you are now specific. Yes, you have it. And we say that we want you now to relax. This is why we're talking about mindfulness exercises and commitment. You need to take an action. You need to come out of this anxiety which you are having. And then they say, yes, let me try. So that they come out of it. That is the acceptance and the commitment to that therapy, so that they can be able to take a step. Then we have the mindfulness-based cognitive therapy. It's a combination therapy whereby you're using the cognitive and you're using the mindful strategies to help these clients so that they can be able to be aware of their thoughts and their feelings. As long as you are aware, me, I have an issue. I fear talking in front of people. I fear standing firm to talk about what is in my mind. And then here you're told that, yes, but now you need to learn this technique of being assertive. Can you talk about it? Just be telling people, because some people feel like if I say no, I'll hurt someone. But if you mean a no, can it be a no? Then we have the psychodynamic therapy. This approach explores the unconscious processes, especially on those past experiences. When you hear psycho, they take us back to our past experiences. They take us back to our childhood experiences. They take us back to the issues we have repressed, to the unconsciousness. So those are the past experiences that may contribute to this anxiety. And that is why you find some people, because they have repressed those painful experiences, those experiences which were embarrassing them, when they are talking or they are sharing, they don't want to talk about it because it might trigger those painful experiences, but we want to help these clients so that they can be able to talk about the anxiety they have or those painful anxiety issues they were going through, so that they can be able to gain that insight into their emotions and how it is making them to act. And that is why we say that mostly some clients, they use what we call the resistance. Resistance is whereby someone doesn't want to go deeper and talk about some issues which they have already repressed because they were so painful, they were so anxious, they were giving us those memories they don't want to be reminded. So you find that they avoid it. But when they retrieve that information from the unconsciousness, they talk about it, is going to help them to gain that insight, is going to help them to become aware about those emotions and how it is even making them to act. When we talk about behavior, is about acting. Then we have group therapy. When you're dealing with the people who are involved in those anxieties, we say that it involves social interaction and support from other people experiencing the similar issues. And that is why we say group therapy. It's very important because as you're in that group and maybe you're having some anxieties, especially maybe you went through a traumatic event, when you are talking, you are listening what the other person is saying, you also come to learn, yeah, it happened, and is not scared and is not having that fear. So you are learning from one another because of that experiential sharing. It can be very effective and is going to reduce those feelings of isolation, because remember, some people like isolating themselves. They want to be alone. They don't want to be with the others. And this provides a sense of being in that community. And we say that these therapies can be tailored to any individuals so that they can be able to manage their anxiety effectively. Any question on anxiety? Okay. What I'm trying to do is to make you understand what are some of these areas we are looking at, so that now you are coming in with that intervention, at least you have a clue of what you're dealing with. So let's move to depression if there's no question. Welcome, the ones who have just joined. So what is depression? What is depression? What is depression? And how will you know that a person is under depression? Yes. And by the way, you also had the mental health issues is also a concern. I don't know whether it has come to your awareness that every organization, at least you need to organize, you train people on mental health. It's a concern. And because of mental health issues, it has made people to go into depression. It has made people to have that anxiety, by the way, is among the issues we mentioned under the mental health. When you're talking about mental health, anxiety is one of them. Depression is there, addictive behaviors, or there's one we call obsessive compulsive disorder, bipolars are there, and those are the ones which are the mental illnesses under the mental health. So it's a concern. So how will you be able to know that this person is going through anxiety or this person is going through depression? So what is depression? In your own words, we usually say that when you are trying to respond, there's no right or wrong answer. We are all right. So what is this depression?
Maybe just to put my thoughts on it, is somebody who seems to have lost interest in life, and they feel like they owe nothing, they are owed nothing, they just flowing on, and they just lost real interest in life.
Mm-hmm. Mm-hmm. Thank you, Edgar. Another trial. Thank you for that.
Depression is also when a person loses interest in taking care of himself, personal hygiene.
Yes.
And the way they look, they're no longer interested.
Yes. Thank you. So imagine you're having an employee who was very active, who was engaging. Now here he is no longer interested in that job. You know, there's some people who like what they're doing. Eh? You do it with that passion. Ruth is saying feelingness of sadness. Yeah, feeling of sadness. Yes, thank you. Thank you, Ruth. So when we are talking about this depression, and I've told you, please be talking to your colleagues. Bring in a sensitization on mental health. Someone is saying, I hope you'll share the notes of this training. There will be in LMS, I guess so, but we'll be able to ask the SHRP on the same. So when we talk about this depression, and that is why, as I told you, like where I work, I'm in charge of the issues of HIV, I'm in charge of the issues of alcohol and drug abuse. But now, NAC, which is the National AIDS Control Council, they came up and said that we are not only dealing with the issues of HIV, they have brought in mental wellness. They have brought in the issues of stress. And remember, this is where I was telling you, when you have stress, and I said stress is good. If you don't manage it well, you go to distress, then it will take you to what we call the post-traumatic stress disorder. When you just hear disorder, that is a mental issue. They have also now incorporated those issues because if you are dealing with the employees who are living or affected with HIV and AIDS, how do you need to talk to them, especially on this issue of mental health? They need to take care of themselves. So when we are talking about this depression, it is a mental health disorder. And mostly it is characterized by persistent feelings of, like what some of you have said, sadness. And normally we become sad. So what is this which is going to make it different from knowing, are you under depression, Ruth? Are you sad because of the stresses you're going through? Or are you sad because of the depression? What is the difference? Because all of us, any human being, you have emotions. You can be sad. Yeah? What will be the difference? You can feel hopeless. What is the difference that you can know? This is the one maybe of stress, and this is the one of the mental illness or the issues of illnesses. What is the difference? Yes? What is the difference? Yes?
Please repeat the question. You're kind of breaking off.
Sorry. I was asking, we talk about some of the characteristics. There is that persistent feelings of sadness. And I was asking, like I'm taking, for example, Ruth, when you have stress, you become sad. We are all human beings. How will someone know whether this sadness you have is because of the stresses you're going through, or this sadness you have is because of the depression you are in? How will someone know whether it's depression or it is stresses you have, the sadness we have? Yes?
I think for the sadness, the first case is if, let's say, the first point that you made in is if you're able to encourage yourself and come out of it because it's more short term, I think it's more sadness. Or if maybe you have a friend or somebody who encourages you and you come out of it, it's more sadness. But if it persists, then I think it goes towards depression, because no matter what kind of intervention that comes in, you don't seem to get any better.
Okay. Thank you. Another trial? Another trial? Okay. As I said, thank you so much. As I said, all of us were human beings. We become sad. we feel hopeless. We lose interest in some of these activities. But when now you are under depression, there's that persistent feelings, and it takes some time. You know, you can be sad, in a few hours, you are okay. But when you are under depression, it can be like even for 4 to 5 days, you're still under that sadness. It persists. It takes longer. So whatever here we are going to look at is when that behavior or when that act persists and takes longer time than the normal other feelings which we go through. That is what maybe makes the difference. Because like at times you can feel like, me today I don't feel like going to give a talk. But then after tomorrow, you can be given and still you continue. But if I feel that I lose that interest and I lose it forever, sitaki kusikia maneno ya kufunza tena. So it's like you don't have any interest again, and it takes longer time. That is what makes the difference from the normal other emotions which you go through. So this is characterized by that persistence we have talked about of feelings of sadness, which takes longer, even a week. You're just sad. Or maybe that hopelessness. You don't feel like you're of any value, of any meaning, of any significance. You are not worth. Yani, you just feel like you are of no significance. You lack that interest, especially or maybe the pleasure of activities which you loved so much. You are no longer interested in them. You just lose that interest. And that maybe these were things which you loved doing or you enjoyed doing, but now you don't want to hear about it. You know, there are those things which most of us we like doing. Kuna vitu unapenda, and you like doing them, and you do it with a passion. But now when it reaches a time, you don't want to hear. You don't want even to think about it. Then here, you know that now you are under depression. And when you are under this depression, it mostly affects how a person thinks, how a person feels, and how the person functions, especially during their life activities. Because if your thoughts are affected, then they are going to affect the feelings you're having. Then they are going to affect your actions. That means your behavior, how you're going to act in whatever you are supposed to be doing. And when we are talking about this depression, this is where we talk about the major depression disorder, whereby they have those severe symptoms. And these symptoms, they're the ones which are going to interfere with our daily life. And they last at least 2 weeks or so. Hapo najua there's an issue. When it takes that long, a whole week, 2 weeks, you're just behaving the same, then hapa you know there's an issue. Already you have now gone into depression. And that is why we'll be looking, I don't know whether it is in this module, like when a person goes through loss and grief. There are some stages which you have talked about loss and grief. Someone goes into denial, then he has that anger, then he starts bargaining, then he goes to depression. And this person, if he can be supported, he can come out of that depression and he comes to acceptance. So that graph goes deep and then it comes up. So that is the one we are saying that this depression, it can make an individual to be there for even 1 week or 2 weeks, just having the similar behaviors, because it's going to interfere with what they love to do in their daily activities. This is where now another depression is whereby you have seen people or you have had people who have bipolar disorder. And this bipolar, this one, it's like, it involves whereby they have those mood swings. Sai wako sawa, you go to take your lunch, you come back, you're trying to talk to this person, he's so down, he's so moody. And it's like, what has happened? We were okay. That person is having those bipolars. So they have those mood swings. Today they're happy, tomorrow they are not happy. So they're just there. So, and also we have the seasonal, how do we call it? Seasonal affective disorder. Like I remember when you have this depression, it relates to the change of season. You have heard where people say when maize is shooting, I don't know, the whatever, people become so sick. Have you ever heard of it? Or during the cold season, like now, then people can be able to be showing those signs of depression. And this is when the flowers are flowering. Have you heard about that? When the flowers are flowering, when it is cold, it depends with the season. This one can also make people to be more depressed during those seasons. Have you heard about it? That people can be depressed because of cold season? When flowers are starting to flower, yeah? All those ones, eh? Okay, so how will you know that a person is under depression? How will you know that a person is under depression? Or Raphael, yes, you have heard about it. Some people even start sneezing, ati ni vumbi, or maua, flowers, nini, yeah. So how will you know that the person is under depression? Emotionally, you might see these clients or these people, they're having that persistent sadness. They'll be having that anxiety. They'll be having that feeling of emptiness. They'll be having that irritability. Something very small irritates them. Something very tiny. Then you know this client has that depression. Cognitively, they cannot be able to concentrate. They have difficulty in concentrating in whatever they want to do. They do it, they leave it, they come back. They don't. It's like they are not themselves. They also have difficulty even in making decisions. They're not able to remember some things. You ask them and they tell you they can't remember. They also have that feeling of worthlessness. They have that guiltness. I wish I've done. I cannot be, it's because I'm not doing this. I'm letting my mom down or my dad or my colleagues. And these ones are there. If it's about physical, they can be able to change, like the appetite. Maybe they don't eat or they can eat much. There's that issue of weight. It adds or it decreases. They cannot be able to sleep well. That is sleep disturbance, insomnia, whereby they can either oversleep or they don't sleep well. They are fatigued. They feel so tired. There's that loss of energy. And also the causes, as we looked at the other one of anxiety, they're almost similar. If you had a person in that family who had gone into depression, it means that there are those genes, that genetic issues. They can also inherit that. It can be biological, which we talked about, maybe the brain damage or something like that. It can be either because of the environmental issues, whereby we talk about the life stressors. Remember the stressors we are talking about, which some of us go through. If you're not able to manage them, they can take you into that depression. Maybe major life changes, things which you are not expected. Maybe you are dependent on someone, and all of a sudden that person leaves you, anakupatia red card, then you remain all alone. Things you are not used to, it can take you into depression. Or you are given separation or divorce and you are not ready for it. Unakuja kushtukia, it can take you into depression. Or that chronic stress, it can make us to go into depression. So psychologically, they usually have that negative thinking pattern. There's that low self-esteem. They have that chronic anxiety. Remember, we talked about they're always having that fear, whatever they are fearing. So we want to look at this depression. What can we do regarding this depression? What can we do regarding this depression? Still, we are using, remember we said, we need to borrow from the theories we learned, and you try to apply them so that you can see how you can intervene and help these clients. And one of them, effective methods, is maybe the cognitive behavioral theory. It is used to help, is used in therapies for the depressed clients. And this one, it identifies, most of it here is to try to help these clients because cognitively, they cannot be able to concentrate. They cannot be able to make decisions. They are always having that guiltness in them. They feel like they are so worthless. And the first thing they need to do is just to they reflect to themselves, they look at themselves, and what is this they're going to do differently than what they've been doing. And that is why we are using that cognitive restructuring, so that cognitive restructuring, and we start now being rational. We start looking at those activating events, and we look at our belief in that, so that we start thinking rationally instead of being irrational. The interpersonal therapy also, it's focusing on improving those problematic relationships, especially when we're talking about the circumstances that are maybe closely linked to the current depressive episodes. And we said those ones can either be the environment in which we are. You can be able to maybe change that environment where the clients are, and you can look at circumstances, how people can be able to look at things differently than the way they're looking at them. Like when we talk about this issue of environment, yeah, because they're affecting the relationship with these clients, how they're relating with the others, those traumatic major changes which they are going through, those life changes, those chronic stressors which they are going through. How can we be able to remove them from these stressors? And this is what can be able to help them maybe to cope, and they accept whatever they are going through. And that mindful-based cognitive therapy, it combines cognitive therapy and mindful strategies, so that you try to help these clients to become aware. Something else we need to do is first to talk to these clients, and that is where you find the clients who are under depression. You cannot just refer them to go and see a psychiatrist. But the first thing, as you're talking to them and then you realize that they have a mental issue, we are supposed to refer them to see a psychiatrist. So when they go to a psychiatrist, they're given medication. And after this medication, they're going to stabilize. Now, when they become themselves and they can cognitively change, then it means that they can be able to start reasoning. That is now when you bring them so that they can collectively structure their thoughts, and they start reasoning, and they start looking at it. What else can I be able to do? You know, at that time, they can be able to reason because they're under the depressants. What can I be able to do so that I can be able to come out of this situation? And that is where we are saying they be aware of their thoughts and the feelings they're going through, so that they can be able to reduce these depressive symptoms. So that's why we say when they are not themselves, at times you cannot be able to counsel them, but they can go for medication. When they come back and they are stable, then now you can be able to continue counseling them as they are still taking their medication. Then we have that psychodynamic therapy. This approach, remember, we talked about those issues the clients have repressed to their consciousness. If they can be, when they are now stable, they can be able to retrieve that information. When I'm talking about retrieving, they can be able to remember. Or you can also even talk about the dream analysis, where they can be able, as they go to sleep, there are those dreams they dream. And that is now when they come up with these dreams, you try to interpret them, you try to maybe find out what this dream is all about and where it is coming from, what made them to have that dream, so that they can be able to start now becoming aware of what is making them to go into this depression. Then we have the behavioral activation. when we talk about the behavioral activation, this is where it focuses on helping clients to engage on those activities which are meaningful. And which, remember here we have said that mostly the activities which they enjoyed, they are no longer interested. Now you try again to making them to go back so that we see if they can start again enjoying those activities which they had set aside. They didn't want someone to talk about it. This one is going, it can help to improve their mood and reduce those depressive symptoms. And that supportive therapy is also very key. And remember, these clients are very, very sensitive. They want to see how you are treating them. So they want you to be closer to them. They want you to be near to them. And you show that supportiveness, that you are imagining what they are going through and you are there for them. Anytime they need an assistance, you will be able to support them. Actively listening, empathizing with them, like the ones we talked about. And remember the other ways also to manage this depression, to add to what you have just talked about, those regular exercises. The regular exercises are the ones we have talked under behavioral. It comes regular exercises. And again, the healthy diet. Let them eat healthy diet, a balanced one. And then they should be encouraged to take that sufficient sleep. And that is why they're given those deep placements so that they can be able to sleep. And also they can be able to use those management of stress management skills, because those stressors are the ones who are going to trigger this depression, this sadness, this hopelessness. So please let them try to manage their stress well. Adding to what I've just talked about, and even taking those antidepressants. And if they have their medications, always encourage them and let them follow that schedule, because that is why we say you need to be encouraging and motivating your client at all times. And that is why we talk about the mental health. It doesn't choose but who is going to be mentally ill. But some people, when they have these issues, they don't want to talk about it because of that stigma. But despite of the stigma, it's good someone talks about it so that they can be able to be assisted. Any question up to there? Let's look at the other area, is about the issue of loss and grief. When we talk about loss and grief, it's inevitable. It's inevitable that no one will ever go through a loss. No one will be able to grieve. And I know even as we are here, some of us, we have gone through that loss and grief. And when we talk about loss and grief, it's not only about death. We usually talk about loss is that experience whereby you are losing someone or you are losing something which you valued so much. You had that attachment to that item or to that person. And then all of a sudden it is deprived away from you. That is a loss. And when we talk about this loss, this is a personal experience, which is maybe going to end that relationship and is going to bring in that significant change. And when we talk about loss, by the way, loss is about what? What can someone lose? What can someone lose? Ndio useme, wow, this person needs to be cancelled. What do you think that employee or that colleague or that friend or that relative might lose? Then you say this one person needs to be assisted.
When you're in a close relationship with someone and then it breaks up.
Ndio nasemanga ukiwacho wachika. Yeah, yes. And this is why you find some people, when they're in those relationships and then the relationship comes to an end, someone commits suicide. Mbako unawambia, well, yours is not yet born. Don't eat a loved one. What do you mean, Karemi, by a loved one? Doing what? Huh? Which are these types of losses? What is this maybe someone can lose? When you lose a pet, is that a loss? Losing
Yes,
a pet?
loss depending on where you are. If you're in the western parts of the world, I see they value pets probably more than humans, all due respect to them. And
So is it
when you lose something you value,
mm-hmm.
that is where I believe the loss comes in. It's something you value in life, be it life,
Yes.
be it an asset of some other kind, be it a value system in itself. So that is where you probably you get through a loss. But again, like it's been mentioned, obviously, some of the loss that impact on us very negatively is the loss of a loved one in terms of not only in death, but sometimes when you have to part ways. And when you've invested so much in that, and then the loss is, it's felt really deep.
Yes. Yes. In fact, there's one of my students somewhere who was sharing in class. He took a loan. He saved so much, and that money was not enough. He went and took a loan. He went home. He bought a cow, and then unfortunately, after 3 months, that cow died. He became sick, and like, no, better. Not just that's a cow. It is the attachment he had. He wanted to own one, but now it's no longer there. Imagine the way you has been saving, and you buy a good cow. When you're working, you buy a good cow. And imagine then all that goes into drainage. That is a loss. So, some of us have said that when you lose a loved one, or you lose a pet, by the way, that is a loss. Even like you had the houses which were being constructed. You remember the one which was being at River? And they were good houses. You remember along the river side during the rain season, they demolished those houses. Do you think that was a loss to those people who were living there? Those were just slums, they were scanty houses. Was it a loss?
Absolutely, because people have invested in that, and that was the only hope, and that is where the loss really comes. That was the only hope. So beyond there, they have, I mean, their world comes to an end, and obviously they turn into something else that you wonder who the people really were, because it pushes you to the edge.
Yes. So when I'm asking that, when we talk about a loss, to you, it might sound that was a slum. But to that person, that is their modaiga. Now they no longer have it. Maybe they had they were getting some income if they were landlords. If they were tenants, their houses were affordable. Now they no longer have them. That is a loss. Whether, I have a sister who lost a cat. Do you know she really cried? Mpaka from that time, I told her to pick another one. She told me, sitaki. She got emotionally attached to that cat. Imagine it used to eat even more than what I eat. And I was like, she really loved it. But since that cat died, ataki kusikia about any cat. Because she's like, what if I take it and again, she becomes so close to it and then it dies? So when we are talking about death, it's not only about a person, it can also be an item. And even ending that relationship or even a friendship, it's also a loss. Even when you are losing that sense of identity, or even when you are demoted, is that a loss? You can be demoted. From where you are, you come down. Already that's a loss. So there are many losses which we go through. So when people go through a loss, then they also go through what we call a grief. They grieve. And when we talk about grief, now this is the emotional response to that loss. You have lost. How do you react to it? So how do you feel? How it may be that feeling of sadness, that feeling of anger, that feeling of confusion, that guiltness, that is the emotional response to the loss which you have gone through. And this is where at times In fact, where I used to work, a colleague lost a mother. And the immediate supervisor alimwambia, when is the burial? Alimwambia ni Friday. So when are you leaving here? On Thursday. You come to work until Wednesday. Then you leave for Thursday. Hardly 1 year, the immediate supervisor lost the father. Do you know what happened? For 2 weeks, he never appeared in that office as they were planning for the burial. So what is this which was different? When he comes back, he's like, you mean that is how it feels when you lose someone so close? I'm so sorry that I let you to stay here until on a Wednesday. Must you wait to go through such a loss so that you know how it feels to help other people? And that is why we say, no matter whether you have gone through any issue, your client is going to take, maybe your client is going through, but we usually say that you try to work with them. You try to imagine what the other person is going through. You try to enter into their world. Their world means into their situation so that you know how it feels and you try to help them. Not that you have to go through, so that you know how it feels and then you see how to assist people. Please. Like what that boss did, I hope no one ever will do something like that. So don't just wait to go through so that you know how it feels. So that grief is that emotional response, and the emotional response are those emotions which we are able to express because of the loss which we have gone through. And I just want to mention briefly about one of the psychologists with whom we call the Susan, no, not Susan. She's called Elizabeth Kubler-Ross, who did a research and said that a person who is grieved, you need to take them through a process. And this is why you find at times some people, when they go through a loss, they don't really go through that grieving process. And one of the stages she talks about, which Elizabeth talks about, is the first stage when you get that news. You go into a shock, and then you start going into denial, the denial. So the first stage when you're going through the grieving is the denial. There are some clients who deny. You are being told, you know, like, by the way, for me, I'm supposed to be transferred somewhere from Nairobi to another place. And I'm like, I'm still in denial. No, it cannot be. I have very few years to go, not even years. I have very few months to retire. I don't think I need to be transferred. I'm still in denial. Not accepting the reality. You are trying to reject what is true to look like it's not true. And that is why you're told, you know, so-and-so who has been ailing, was in hospital, has died. No, it cannot be. I'm the one who gave that client food. I'm the one who, she talked to me nicely or he talked to me nicely. It cannot be. So clients start with being in that denial, whereby they start denying the truth, or they reject the truth and it sounds like it's not true. And when we are also rejecting this, by the way, it becomes very difficult for someone to adjust, so that you accept whatever has happened to move on. But it's okay to deny. Remember, under the psychoanalysis, that is where we get this, whereby clients, maybe we use a defense mechanism, when one of the defense mechanism is denial. You're rejecting that reality. It is okay, what Freud says, it is okay to reject, but you should not prolong being in that denial. For that time, it's like when you deny, you say, no, it cannot be. Like it has helped you to breathe. Then you move on. Then after you are in denial, clients move to anger. They start having that anger. Remember, they are now venting out. They're reacting to that loss. So they have that anger because already they're so hurt of what has happened. They talk with a lot of pain because they're having that anger. How could you have taken this? Then after that anger, they go to what we call the bargaining. God, the way I've been fasting, the way I've been praying, the way I've worked so hard, the way we have taken them or her to a very expensive hospital. Why did you have to do this? Why is it that it was for me that you had to do for me this? You know, you are bargaining, you are asking, why me, why what, why God did you do this? And this is why you find most people that you now tell them about God. They tell you, I don't want to hear, don't pray for me. I don't want to hear about that God. Where was he when I was going through all this? Because they bargained. Now, after that bargaining, here you find a client now gone into depression. And this is where we talked about that feeling like so helpless, so hopeless. They start having that sadness. They feel like this world is of no meaning again. Why am I to live in this world? And these are the ones now we need to help these clients so that they can come out of that depression. They come to the last stage, which we call acceptance. Acceptance is whereby you note that it is all right that someone has died, but you try now to cope, to live without the deceased or the item, because life has to move on and you have to fill in those gaps and you have to transit from one level to another. You start picking up those responsibilities which were there, which that person used to take or to carry, so that you can be able to take them. So, and again, that is now when we are coming to the loss and grief, whereby we say some effective methods. We are just using the same theories, and there are so many others which we have not even included here. And that is where we are saying that cognitively, a person needs to change their ways they are thinking about the losses they have gone through. They start now reacting differently. They look at things in a positive way, yeah? And remember, if you're always negative, even if you want to come out of that depression, you don't see anything you need to live. Kwanini, I don't have a reason why I need to be in existence in this life. So you feel like you are of no value, but we want to help clients using this cognitive to change their pattern of thinking. And this is also where we talk about the issue of acceptance and commitment. And this is where we have said, if a client has undergone a loss and they are under depression, they want to be helped so that they can come to acceptance. Acceptance is whereby we are now, the last stage which I've talked about, we are supposed to encourage our clients that life can still be going on. How are they going to bridge this gap? Remember, when you are being in denial, going to bargaining, umeanza kwenda chini, then you have that anger, you start bargaining, you go into depression, you have gone down, now you want to come up. You come up so that you can be able to go to acceptance. So how do you bridge this gap? You have to accept, because whatever roles this client used to play, they have to be done. Kazi itaendelea, work has to continue, things have to continue, life has to continue with or without that person or the item which you lost. So this client has to accept the thoughts and feelings they're having, and they look at the positive way on how they can be able to handle that by getting committed and thinking around them. The mindfulness is whereby you sit down and you start thinking what is around you and how you're going to deal with those issues, okay? Then we also have that interpersonal therapy, which focuses also in improving relationships. Remember here, like there's an exercise we do, we ask, who is the most important person in your life? Whom do you value in your life? And this most important person in your life is the person who is your support system. And then you find that the person who is your support system is the one now whom you have lost or who has passed on. And that is now the person we are supposed to talk about here. And then after some time, it's like when you ask a person, who is your most important person? They still put that person already who is deceased. And we requested them to bring someone on board who is going to replace them, who is the other person next to that person who passed on, because we want to help them to improve their relationships, their social functioning. It helps them to cope with this grief, because as much as that person they valued so much is no longer there, they need to have someone who is next to that person they valued, who is no longer there, so that they can be able to be relating. When they're having challenges, they have someone whom they can be able to talk to. And that is why we encourage people not to be alone. And that is why we say the people are bereaved. Please, it doesn't mean that you only need to be sending money. Even your presence, that moral support. And that is why you find some people using one of the techniques we call humor, especially for the people who are debriefed, who are grieved. When you go there, you find after you reach, someone cries, and then after some time, just sit, have a cup of tea, you can sit here, and then stories start. Then they start now bringing stories. Do you know those bereaved, they forget that they have undergone a loss? That is the humor we are talking about, that relationship. We want them to feel closer, that they have people they can talk to. That is also something we need to be encouraging. So maneno ya just sending money is not enough, but we need to be closer to these people. We need to be encouraging them so that they can be able to have that social functioning to help them to cope with this grief. It addresses the issues like role transitions. This is what I was saying. They replace someone who will be taking up the roles of the person who has passed on, and that interpersonal conflict. Instead of having the conflict, they try to replace them. Then we also have that grief counseling, which emphasizing on helping clients navigate the grieving process, like what I was talking about, like the stages we have talked about, which includes helping clients to accept the reality of their loss, accepting. And as I said, that accept life to live without whatever losses I went through. The process of the pain of grief, adjust to the world without the deceased. It's telling me your internet connection is not stable. I hope you are getting me. If I get lost, please let me know. Then this is what I was talking about. You try to adjust to a world without the deceased. You live without them. If this is your spouse, how do you move on? Remember like what happened during the plane crash, the one which happened with our general. Those people, most of them were male, some of them it was a mother, they were fathers and whatever, they died. It's not that it was okay, life has to move on, but those people have to adjust to live without the deceased, the kids to go to school, the family to move on. So and find an enduring connection with the deceased while moving forward. And this is where you find the people who have not gone through this grieving counseling process well. When someone dies, they don't give out their, you just hear someone saying, oh, just listen. Is it his voice or is it her voice? And that's someone who died so many years ago. In the wardrobe, they don't want to remove their clothes from there. When they're setting the table, they just want to put their plate there, that he might come back, because that person has not gone through the grieving process. And those are some of the things. And some people have to go to the graveside every, maybe morning or every week or every month. Then that means that person is still grieving. And that is why we say when you are grieving, if you lose your child, for how long are you supposed to grieve? If you lose your spouse or a relative or a friend, for how long are you supposed to grieve? It will depend. That's why you see for men, with due respect, when they lose their spouses, hardly 3 months, you hear there's a wedding. Have you ever heard of such? For how long have they grieved that they're getting married, starting another relationship and moving on? For how long do they grieve? These are the sample we are taking here, the men in the house. How long do they grieve that they can be able to marry someone? Or even the ladies, for how long do you grieve for your spouses? How long does someone grieve for their children, for a child who has died? And then here they say, for grieving for your child, it's forever. For grieving for your child is forever, because this is your own. But for your spouse, we say that, yes, you need to start a life, you need to move on, you cannot be able to be like that, but they say that at least give it some time. Give it some time before maybe you start a new life. But for your child, you grieve forever. Then we have group therapy, whereby you can also be able, and this is what we're saying, how you form groups. Maybe the people who have undergone a loss, like the people whose houses were demolished, they can be put together. Maybe the tenants together, the landlords together. Those are different groups. Maybe you can also talk about if a colleague at the workplace, let's say, for instance, passes on. There's one of us who passed on, and I felt like the people in that department, it was under HR. You need to put them together, because this is a colleague, they have been working very much close, and then you find the peers whom he was very close with, you can form a group. And that group therapy, it provides that supportive environment where clients can share their experiences, how they loved this person, why they will lose maybe when this person has died or is no longer there, or whichever. Even when people get transferred, by the way, some go through a loss. Even when maybe someone, especially those transfers, kuna wengine unasema, I pray for this person to be transferred because it's not good. But when a person is good and you hear that he's going, some feel so bad. Even during the time of retirement, people, that is a loss. People need to be put together into a group so that they can be able to express what they will be losing about this, but they take it like it's normal, whereby some organizations, they're supposed to take their staff for pre-retirement training. There's no money, it's not important. And that is something which is very critical. Remember, these people, they're having a lot of anxieties. They don't know what they're expecting out there. They need to be taken through maybe about this personal financial planning. And this is what I usually say, please, if you're in HR, can you bring in that component of talking to your staff on the issues of preparing themselves? Not that you wait when I have like 6 months or 3 months is when you want to talk to me. As long as maybe whatever age, let people be prepared, because nowadays, job is not permanent and pensionable. Anything can happen. The economy may be the way it's going. So many people lost their jobs during the COVID, and they didn't know that they were to lose it. So let people start getting prepared that what are they doing for the time when they are on that job, they plan for it. So all these losses which you're talking about, when especially you do it in group therapy, it's very, very important, because it's going to help these clients to work in case of any loss which is going to come, or whichever losses they have gone through. Any question on the issue of loss and grief? I know when we train that issue of loss and grief, what we usually do, because now we don't have time, we help them, we give them a chance, they share their experiences on the losses they have gone through, how they managed that loss, what they did, and it's very, very emotional. It's very, very emotional. But we usually say it's good when you vent out those emotions which you have repressed. And I know most people, when they have undergone a loss, let's say someone dies, let me use that one, which is a bit painful. There are some people you see, they're very strong, and with due respect, there are some people who come from, let me use this with due respect, I've said that, Central or Eastern. If you don't view the body at mortuary, you don't view it anytime. So when the person is buried, people don't cry. And this is with due respect, the ones who are saved. Don't cry. You know, the Bible says, don't cry as if you don't know that there's a second coming of Jesus Christ. Who told you that crying is bad? Mourning is bad. It's good you cry, you vent it out, you let it be, you let that emotion. So that when now, even Jesus wept. And why are we not weeping? And we are just saying that, no, you know, you cannot. It is okay. What is not okay is the loss which you have gone through. So express it. There are some people who become strong for the others. Let me tell you, for instance, I die now, and then you attend my funeral. You'll be crying like nothing else. And then someone asks you, David, why are you crying? Oh, no, Flora was a very good trainer. For how long did you interact? Just 2 sessions. Oh my God. Now, kumbe, you're not crying about Flora. It has triggered your previous grief, which you never grieved. Now it is becoming fresh. And that is why we say most of the issues which we have repressed to the unconsciousness, they are not resolved. No matter how long it takes, it will come to the consciousness. It will be very fresh. It will be like it has just happened. So those are the unfinished business we are talking about. Why can't you finish that business during that time? So that when you go to another funeral, it doesn't get triggered to remind you where you never grieved. So grieving is okay, screaming is okay, shouting is okay, viewing that body is okay. For us, for people from Western, we really do it. We are professionals. You can hire us because at least you vent out, you look at them, you talk to them. You know, even in that grieving, people talk. Why did you have to die before I came? So you tell them whatever you want to tell them, but we have a technique under the Gestalt theory, which we call the empty chair. Whatever issues you wanted to tell the deceased and you never met them, you use that empty chair for you to talk about it. That is a talk for another day. Thank you. Any question on loss and grief before we go to self-esteem? Before we go to self-esteem? Okay. The other issue is self-esteem. And under self-esteem, we have covered it, or it has been covered under a theory we call person-centered. Person-centered is humanistic. And the humanistics, always they say that it is the client who leads. Yours is just to follow. Is the client who knows about their issues better than you. Yours is just to listen. They don't need you. You're only there to create that conducive environment for them. You're only there to unstuck them, and you let them take that responsibility. So when we are talking about this self-esteem, this is like if someone was to ask you, if you were to go to a marketplace, the ones whom we are here, if you want to go to a marketplace and you're asked, you tag yourself a price, how much do you think you are worth? How much do you think you're worth? And don't say you are priceless, because there's nothing in the market you find which is priceless. How much do you think you're worth? Are you of any value? Hello.
Absolutely, Flora. What happens is you put a value on yourself on the way you carry yourself, the way you treat others, the way, of course, you treat yourself first, that you treat others, because through that, you put a value to yourself. We may not put on monetary terms, but basically the positivity that you radiate, the compassion that you share,
yes,
and the way you assist others also reach their goals puts a value to yourself, because then you are valued by them more than you value yourself.
And thank you so much, Edgar. Have you ever treated yourself? Have you ever appreciated yourself? Have you ever maybe treated yourself well and you say, hapa narudishia mwili pole? Have you ever treated yourself? Have you ever bought yourself a gift? And we are very fast in buying other people gifts. What about yourself? Have you ever bought yourself a gift? Virginia, have you ever treated yourself? That you can go, you eat well, you enjoy, Uh-huh. Oh, you're always thinking like.
Yeah. So sometimes when you're happy or you feel that you've had a good day, you just go and buy those. You go and buy yourself maybe something sweet and some wine or whatever, and you gift yourself.
Ugutu, have you ever treated yourself? Ugutu ametoka kidogo. Evelyn, have you ever treated yourself?
Yes, not once after an achievement of a set activity or goal.
Okay. Na mimi mtu asiniulize, mimi niko na mashida mingi sana. I don't know when I treated myself last, but we always forget about ourselves. Thank you so much. And that is what we are saying when we talk about self-esteem. How do you value yourself? This is an individual's sense of self-worth or personal value. Whom do you think you are? The beliefs about oneself, that confidence you have in yourself, that competence, that perception of one's abilities, and the attributes which you have. By the way, they can boost your self-esteem. But if you're not confident, then it means your self-esteem is going to be so low. And this is why we like saying, people don't like me, they don't appreciate what I do, then your self-esteem becomes so low. If other people are not appreciating you, what are you doing to yourself? Must it be that other people have to appreciate you so that you know that you are a person of value? It has to start with you. It's not about what people are saying about you. You appreciate who you are. You appreciate what you have done. Even if they say that this work, you didn't do it well, you tell yourself you tried your best. It will not affect you. So the high self-esteem, it involves that feeling of feeling positive about yourself. And whatever you are doing, you do it with all your heart. Whether for them it looks like it's not good, but you have done your best. Then you ask, which areas do you think I need to improve? So that next time you can be better. But the people who have that low self-esteem, this can also lead to feelings of inadequacy or having that sense of self-doubt because you're not sure about yourself. And that is why we say, before other people appreciate you, you need to appreciate yourself. Always tell yourself, I know I'm a person of value. Wherever you are, if you are in that organization, you are there because of a reason. You just never went there. So when other people look at you like you're not supposed to be there, you say that I also went through the same channel with you. I went through the interview, I was taken, and I'm trying my best. If I'm not doing that, I need to be supported to be better than what I am. But I have that potential. So you appreciate yourself. That is what can be able to boost your self-esteem. And I know someone will tell you one day you wake up in the morning, you are looking good, or you are handsome, or you are beautiful, you are smart, you are what? You feel good. Your day, you don't want it to end. But when someone asks you, oh my goodness, how do you look? How did you dress? You mean there was no one, you want even to leave your workplace earlier before the other people leave, because now they've given you a negative feedback, which is going to affect your self-esteem. So factors which are also affecting this self-esteem, we usually talk about your childhood experiences. Your childhood experiences, how were they? Were you from that supportive family, which you felt like you got what you wanted, you were there, even you are doing it in a small way? Were you being praised as you're growing up? When you're being praised, it gives you that confidence. It doesn't matter the family you have come from, the background. But if your family members were there to praise you, you can go places. You are so bright. You can make it. Even if you're struggling to get the school fees, I know you are a bright child. That encouragement you are getting, by the way, it starts making this person to have that self-esteem from that childhood. That's why you get very young children, they can stand in front of maybe a group of people, they talk confidently because they have been praised, they have been encouraged, they were being supported. But when you keep on criticizing a child or neglecting to support this child, whatever they do, and say, I knew you couldn't make it, it makes a child to have that low self-esteem, and they will always be having what we call the self-doubt. If you look at the theory of psychosocial support, where you're talking about that doubt versus that autonomy. So please, what are we doing to our children so that we can be able to boost their self-esteem? There's also that social comparison, when you're comparing yourself with the others. When you look at yourself and you look at the other person, even the way they're dressing, you are not dressing like them. So it makes your self-esteem to be low. And that one, you just tell yourself, whatever you are wearing, whether it's a second-hand cloth, and you are comfortable in it, you appreciate it. But when you start comparing yourself with the others, that is what we call the condition of worth. You want the other people to appreciate you. This external, we call them the external locus of evaluation. This is what makes the self-esteem to be low. So can you be able to make your self-esteem to be high? Let's not be comparing ourselves, because we are very unique. Let's not compare ourselves with the other people. You as an individual, who are you and what do you make yourself to be? Then we have those accomplishments, which can also influence our self-esteem. What is your achievement? And this is what we do when we are looking at that exercise of My Shield, where I asked the client, like, who is your most important person in life? There also one component where we ask, what is your achievement? Especially for those clients who are so low. Especially those clients who feel like this world has no significance for them. They feel like they're of no value to live in this world. When you just ask that client, what is your achievement? What have you ever achieved in your life? Your accomplishment. By the way, that one now makes a client to start, give me a minute, just a minute. Sorry for that. So we were talking about that self-esteem. Let not people like, when you're asked about that, what is your achievement? A person who was having a very low self-esteem, they start talking about their achievement. It doesn't matter to you, the achievement that client has achieved, as long as for them, they feel it is something which is of great importance. You know, there are some people say their greatest achievement is to have gotten a diploma or a degree. And then what is this which makes you to feel like this diploma is the one which is your greatest achievement? You know, I've been doing casual jobs. I get money, I go and pay. I go out of one semester, I go back until I complete it. So I value it so much. So people have those reasons which has made them to have their accomplishment or to have that success. And this one, it boosts them their self-esteem. And always, when a client talks about that, you encourage them. That is so encouraging. I know, Virginia, you will go far. You know, when you tell someone like that, you're already boosting their self-esteem. By the way, there are some people who have struggled to achieve whatever they have. Even if they tell you, I've taken a loan, I've bought this plot, I have an iron sheet shelter where I'm living, and I started from zero. It's an encouragement. You encourage them. If you have managed at this age, I know you'll go places. You know, you're putting that positivity in this area, and this client is going to boost their self-esteem, especially when they talk about their accomplishment, their success, those achievements. They're going to boost their self-esteem. But when they're always, and that is why we say in counseling, you don't depend so much on the negative side or those negativities, things which are not good, because this one, you're going to demoralize your client and you're going to maybe affect their self-esteem. You don't dwell on the negative side of it, but we want to dwell on those supportive areas which are going to facilitate that change. And that is what we want to look at. Please, always, before other people appreciate you, can you be able to appreciate yourself? And under that, counseling for self-esteem issues involves in various therapeutic approaches, which helps clients to build their healthier self-image. Self-image, and that improvement of their confidence. The self-image are those labels we are giving ourselves. Like, what is this? There's that you're telling yourself about your self-image. There's that what other people are talking about you about their self-image. And by the way, this is where we also look at one of the models we call the self-concept, whereby we have self-image, we have ideal self, self-esteem, and body image. Those ones, they help us to understand who this individual is. But now this self-image, how do you describe yourself? What do you tell yourself you are? What labels have other people given you? There's that what the public says, and there's that what you as individual, you talk about yourself, which needs to boost yourself. So what the public says should not affect you. They can talk positively or negatively, but pick the positive so that you can be able to improve on your self-image. Like when you talk about you're hardworking, you are a person who is kind, you are a person who is approachable, it builds your self-image because it is describing who you are, and that is what we're going to improve your confidence. And once you have that confidence, then your self-esteem still will be higher. So under this, as we are talking about that, cognitively, we need also to look at things in a positive way. And let's use this acceptance and commitment. You accept the feelings, you accept the thoughts, you accept whatever you are telling yourself, and you move on. Let not people praise you on what you are also doing. Then I'm not, like when we are also talking about this self-esteem, there's what we call the narrative therapy. Narrative is whereby it helps those clients to reframe their life stories in a more positive light. Because let's not be going to and that is what we usually say, even in our normal life. We mostly, if I've done good things, mostly they're not recognized. But if I do something wrong,
Mwalimu, we've lost you.
Yes. Yes.
You ulipotea for about 1 minute.
Wow. So I was where? Narrative? Thank you. Your net challenges. Were we at the narrative?
Yes.
Okay. Thank you, and thank you for that notification, because net sengine technology. Sorry for that. So you find this therapy, it helps the clients to frame their life stories like in a more positive light. Whatever is negative, how can you change it so that you start talking about it positively? Focusing on your strengths, focusing on what you have achieved, focusing on what you have done, which can be remembered or people can talk about. All those good things, those are the ones we need to be more talking about. That is the narrative therapy. And by the way, when you do that, it boosts. Like someone maybe says, I managed to do 1, 2, 3. You are looking at positive things. And for that, it's going also to boost your self-esteem. So please, let's not be dwelling on those negative things. If you want to boost your self-esteem. Compassionate focused therapy, this one, it helps these clients to develop the self-compassionate and reduce that self-criticism. And you know, there's what we call the self-talk, which is either how is your self-talk? Is it positive or is it negative? You're always like, you know, I cannot make it. Even if I'm given this, I cannot perform. You know, that's already self-criticism. You're talking, the self-talk is negative. We want to improve that self-talk to be positive, which is going to involve that mindfulness, whatever is around you, self-compassionate exercises, guided imagery. Sangine unafika tu hivi, you try to imagine, where could you like to be in the next 1 year or 2 years? What is this you're going to do so that you can be able to be there? And how are you going to appreciate yourself because other people are bringing you down? Is first to appreciate myself. Whether they're talking negatively, I'll be able to move on. You know, you're just imagining. You have closed your eyes. You're walking that journey. You're trying to tell yourself what you need to do. Then we have that humanistic and client-centered therapy. And this is the one which was developed by Carl Rogers. We looked at it yesterday, yeah? The one who emphasizes so much on the core conditions. You remember the core conditions? Be empathetic with those clients whom you are dealing with. You work with them, you feel with them, you be at the same wavelength. You try to imagine what they are going through, that is empathetic. Then you unconditionally accept them, conditional positive regard. Accept your client the way they are, without you laying any labels, without you criticizing them, without you maybe condemning them or judging them. By the way, that one can also boost their self-esteem. You also try to be genuine. Genuineness is being real, that the inner you and the outer you matches. When you are doing this to clients, it's also going to boost these clients' self-esteem. And imagine this one is in a therapy and the clients are there. And this is an attitude, or this is a skill, this is a technique which you're going to use. Once you use those core conditions according to Carl Rogers, they're going to help you to explore the client's feelings, how they're feeling. You get it from them. Are they positive feelings or are they negative feelings? What are you going to do so that you boost their positive feelings? If mostly they're talking about how they are so down, no one is there for them, no one is supporting them, you ask them who is their support system. When they feel like they are so low, what is this they have ever achieved in their lives? You know, when you are picking them in that and they talk about it, then it's going to boost their feelings, and they also feel like, yeah, even this small thing I've achieved is something which needs to be appreciated. That is something which you also need to pick on that, and is going to make them to have that sense of self-worth. They are of significance, and especially even the clients who are intending to commit suicide. And the suicidal clients, mostly you find that they like talking negatively. I want to end my life. No one is there for me. No one wants to support me. And it's like, what is this maybe which makes you to feel like you want to commit suicide? What have you ever achieved in your life? You know, it's like you want to bring that issue of valueness, that worthiness, so that you boost their self-esteem, so that they feel like they're people of significance who needs to be existing. So you should not just leave those people there. Then we have also the group therapy, which we talk about creating that conducive environment. You bring people together, they talk about their challenges, they learn from one another. Counseling is more of experiential sharing. You let people come together. As someone talks, you know, you don't know you're touching someone's heart. Like when we were training the people with due respect of Telecom Kenya, by the way, as they were sharing, it really encouraged me. And I told my spouse, we are going to construct an iron sheet house. We moved to our own house because I saw what was happening with that group when they were being retrenched. Being in that group, you learn so much. it's like you are just talking to them, but they also forget that also imparting some information to you. Group therapy is also very key because you learn so much from those groups. So we have addiction. This is second last, which we're going to look at. And when we talk about addiction, this is like, let me take an example. Addiction is when you get hooked to the issues maybe which clients are going through, and you can be addicted. Addiction is not only to alcohol and drugs. Addiction can be anything maybe you cannot do without. There are some people who are addicted to sex. Some people are addicted to clothing. Some people are addicted to, let's say, even shoes alone. Some people are workaholics. That is an addiction, that they have to carry work from the office, come home. You get so hooked to a certain behavior that you cannot be able to come out. And we usually say that if you have this addiction, you need to be assisted so that you see how you can be able to overcome it. Maybe we can look at it from the aspect of the substance abuse, where we talk about alcohol, we are talking about drugs, we are talking about whichever maybe chemicals which people are using, which they are depending on. So under this, we need to help the clients maybe to overcome that or to manage that. And here we say, when we are dealing with the addicts, it's an issue whereby they need to be assisted. And this addiction, which we are talking about, first thing, this is what we call the CBT. If someone has been addicted, he has that substance abuse disorder, and they want to maintain that long-term recovery, we have to start by using that CBT, that is the cognitive behavioral therapy, to help these clients. Why? Because whatever the client does, it's already in their mind. And in this mind, we want to help these clients so that they can be able to make a decision whether they are willing to change. And under addiction, we have what we call the will of change. Under this will of change, there is that person who wants to come out of this substance, use of this substance, abuse of this substance, not use it. One, a person who is willing to change is a person who can change. A person who has not seen that there's a need for them to change, it's very hard for them to change. I hope I'm communicating. A person who has the will of change is a person who can change. But a person who has not seen the need to change, is very difficult for them to change. Why am I saying this? That will of change, it has like, there's that contemplation that you want to, maybe pre-contemplation, you have not seen the meaning of the use of changing, the importance of changing, the impact of you coming out of that alcohol abuse or drug abuse. Then now a person steps on this wheel. He is contemplating, I've seen this abuse or these substances are making me, maybe the consequences. I'm going to lose my job. I'm going to lose my family. The friends, I'm going to lose them. People have started isolating from me. 1, 2, 3. They have seen the need to change. Then now can they maintain? Can they be able to take that action? And at times can they be determined with that action which they have taken? Then it reaches somewhere, client again relapses. Relapsing is okay. And that is why we say, unless they change their cognitive pattern, they think of what they want to do with their life, they look at their life in a different way, from a different perspective than the way they are looking at it. They come up with those strategies on how they are going to handle those triggers of those substances when they are seeing them. They come up with that, what we call the treatment plan. You're using the cognitive so that this client can be able to restructure their thoughts. They look at these substances in a different way so that they can be able to find a good action. And there has to be that motivational interviewing. That this a client-centered approach. And remember, motivation is a client willing. Are they motivated that they want to change by exploring and maybe solving the issues they're going through? And by this, you have to ask those open-ended questions. Remember the skills we were looking at yesterday? Those questions, those reflective listening, those affirmations, the client to feel motivated that it is a choice they are making and it comes from them and they own it up. So there is also that contingence management. This is a method whereby we use a positive reinforcement, whereby we need to encourage that client. So these clients need to receive some rewards. By the way, under the, is it behavioral? No, the cognitive, yeah, behavioral. Under the behavioral theory, we have those theories whereby we are talking about, there are those rewards. Remember the one we did for Skinner, whereby we talked about the rat being in the box and there was that button whereby it was tapping on it, the green button, the food was coming. That is the reward the rat was getting. The same way, what is this reward for this specific change this client wants to take? Always we want to encourage them, we want to praise them, we want to be role model, we talk positively about them. By the way, this one is going to make this client to feel like they're motivated to do that with that reinforcement of appreciating them, the rewards we need to give them. Then there's that family therapy. Remember, if someone is using a substance abuse, they need to be given that support, which involves the client's family in that treatment process, whereby they need to improve that communication, whereby they need to see how to resolve those conflicts, whereby they need to have that support of client recovery. You have always to have that support. And that is why we say we need to be motivating our clients. Even if they relapse, it is okay, you can still go back. And you start again entering in that wheel. So that approach is going to address the family dynamics that can contribute to the addiction. You know, someone can even be able to go to those substances depending on how the relationship is at home, how they are relating. Those are contributing variables, which can trigger someone to say, I go back, I drink, and I come back when I'm drunk. But what can we be, what kind of support do we need to give them so that as they are trying to come out of this, because already they are slaves, they are hooked, so that they can be able to unlearn that behavior. This is a behavior that learned, but now we want to help them to unlearn that behavior. They need to be supported. The family has to be there for them to be able to recover. And the people who have been using substances, we usually call them recoveries. Then we have medication-assisted treatment. This is some of the medication when they are given. By the way, this medication when they are given, when they go to take those substances, they feel nausea, they feel like vomiting. They can be given those medications so that they can be able to come out of that. Then lastly, we have the issue of relationships. And when we talk about relationship is how do you relate with the other people? And remember we said in counseling, we deal with the normal individual who are facing challenges, either which are domestic, work-oriented, or social life. So when you're having this, relationship is key. And this relationship is like, we need always to improve our relationships. And we say relationship can either grow means you can have new friends, you can be with other people, these are your friends. And relationship can also be able to wither, or you can distance yourself. And that is what we say, that some people can even feel like, I need not to be in this relationship. So you distance yourself, you withdraw from that relationship. And that is what happens in a relationship. It can either grow or it can either, you can also distance yourself. This is the emotional focus therapy, which focuses on emotional connection and that attachment between the partners. What is this which we need to express? Expressing our emotions, creating those secure bonds with our clients so that we know our boundaries, whatever we are doing. That's what we talk about. There's one of the exercises also which we do, whereby we talk about, it's called the wheel of life balance. And there's what we call the, how do we call it? Your space, personal space. How can you be able, even the issue of relationship with family, even the issue of relationship with their significant others, how is it, and what is this you're going to do so that we can be able to express our emotions in a healthy way, so that we get to know our bonds, that they're going to exist. We need to talk about it. Then we have gotten model, which was developed by John and Julie, who say this method, by the way, uses research-based interventions to improve relationship stability. This technique includes building the love maps, managing conflict, enhancing that relationship or that intimacy with the other. And that is why we say we avoid using the triangle, the incomplete triangle, that you want to send your child, the child goes to the father and brings the information back again. Instead of it being complete, you have an issue, you go direct to your spouse, you talk to him, instead of you sending a child to go and do it and then you come back. That is incomplete. How do we build this relationship? Cognitive behavioral therapy, if you have said that you really want to improve this relationship, identify those maybe approach so that you can be able to change those negative thoughts and which is affecting your relationship. Maybe it's about communication, maybe it's a way you think about the other person, so that you can be able to work on this. And the communication skills, we need to be trained even to use some of these skills. The skills we are talking about, they can be very, very helpful when we are dealing with clients. And then we also have that image relationship therapy, which focuses also on understanding and healing childhood wounds. There are some people who don't want to be into relationship. By the way, it depends if they have those childhood experiences. Remember from psychoanalysis or psychoanalytic, which we looked at, which is going to affect your adulthood relationship with other people. That's where you find some people, you tell them, do you want to get married? I don't want to get married. I just want to have a child. I stay. Or I don't want just to have, I just want to get children, I come and co-parent. Why? I saw how my parents were living that life. I don't want it. So how do you heal these childhood wounds, which most of the people went through and they saw what was happening? So that dialogue exercise is going to improve that empathy, and we try to understand each other when we are as partners. So there's so much also which needs to be covered here. We have the trauma, and then, and when we talk about trauma, by the way, I'll just talk briefly about trauma. Just give me a minute, I talk about it. Trauma, it's an area which we need to be looking at. And this trauma is like when someone is, when we talk about trauma, is that an overwhelming experience, which maybe someone goes through and you are not planned, you are not expecting it. It's so overwhelming that it renders you to be so, how do I say, so disorganized, so helpless. You cannot be able to use those defense mechanisms which we looked about. You cannot be able to think because cognitively you get disorganized. And this is where now when someone is traumatized, we go through what we call psychological debriefing, which needs to be done within the 72 hours, which is within 3 days. If it is not done, that is post-traumatic. If it's not done, it will take a client to go what we call the post-traumatic stress disorder. So we need to be debriefing the clients who have undergone this trauma. Like when we are talking about the issue of even this Gen Z, there are some estates which were really affected because of what was happening. Some towns, some people were getting affected. Some people were affected because of the floods. All those people who are having similar issues, you put them together, who have gone through that loss, you cancel them. So that is, we usually say when you're going through trauma and you're taken through the psychological debriefing. And have I gotten lost? This insightful. Okay, thank you, Edgar. Like when we are doing that psychological debriefing, it's not really counseling. We call it a first aid. Then after that, 2 to 2.5 sessions, now you refer them where they can be able to seek their counseling sessions. And under this trauma, one thing, because I told you they are already psychologically, cognitively disorganized, is to help them to restructure their cognitive thoughts. And also the prolonged exposure therapy. This is whereby when you get those clients, you can tell them, you expose them to that experience they went through. They talk about it, how it was. They are narrating. As they are sharing, is like you are exposing them to recall what they can be able to remember, which is at times painful, but they're able to express those memories, those feelings, and the situation in which they were. But some people at times they like avoiding. But if you let them talk, that is also a healing in itself. Then the eye movement desensitization reprocessing. This is also another technique which we use especially for the people who have undergone that trauma, whereby they try to imagine or they try to reflect back to those traumatic experiences they went through. Then they start talking about it. It's painful, but let them try to that imagery. We left town, we were at the Thika Road. As we moved to the Chania River, the vehicle veered off. It's got an accident. We found ourselves in Chania River, and I don't know what happened, and that is how I survived. I came out and I found myself that I've already been amputated my hand. They are talking about exactly what happened, which is very traumatic memories. It pains, but it's going to help them. Traumatic focused cognitive therapy is just the same, and the other issues which they're going to talk about. This traumatic experience is good. You also get to know about them because it will help you in one way or the other when you are helping your clients at the workplace. People go through traumatic experiences and they want to be assisted. Thank you for listening, and this brings us to the end of our today's session. Any question? Okay. I know there's a challenge of IT or the net, and I'm sorry for that. Okay, any question before we close up? Any question, any input?
Maybe just one to say thank you. Thank you for that presentation. It's very clear and for me, it's very informative and insightful. I'm a counselor on another end, but okay. I appreciate the key pillars that I have picked from this presentation, which I use each new day. New challenges come every day. Who would expect a challenge of the Gen Zs? It was never in our maybe in our HR program, given where we've come from. But these are emerging issues that we must be equipped as counselors to be able to address, to manage positively, because there are genuine concerns that emerge and we need to be able to manage. And thank you for those key tips. And we look forward to more of this from HCHRP so that we can be better equipped as HR practitioners, as counselors, to be able to build a better team for Kenya. Thank you very much. It's been my pleasure to attend this webinar.
Thank you. Thank you so much. Another input? Okay. If there's no another suggestion, input, inquiry, I'll say thank you so much for your time also to have attended this. We are having our last module from 1 up to 4. So you're most welcome. Looking forward to meet you at that time. Thank you and enjoy your lunch or hamburger.
Okay.
Thank you so much.
Thank you so much.
Thank you.